Hello everybody. We will be studying about brucella today. The organism brucella, how it causes food poisoning in human beings. Let's study the history of brucella. This organism generally it causes a disease called as brucellosis. It was isolated. This organism brucella was first isolated from the British soldiers. Okay, and the how this organism spreads or how the organism causes brucellosis was first explained by Dr. David Bruce, and hence it is named after him. Okay, and the organism, the species of brucellosis that was first isolated was Brucella melitensis. And every year, if you see, around 500,000 cases of brucellosis are seen throughout the world per year. Now, if you see to the classification, it comes under domain bacteria, phylum Proteobacteria, order Rhizobiales, family Brucellaceae, and genus Brucella. Now let us move on to the next one, that is its characteristics. If you see, this organism is gram negative. I'm so sorry, it is written gram positive. It is a gram negative bacteria. It is cocobacilli in shape. Okay, it's not bacilli, not cocci, but it is cocobacilli. And if you see under the microscope, it looks like fine sand grains that is spread throughout the field. Okay, so that's why it is written here, find sand like appearance. This organism looks like that. Okay, if you sprinkle the sand grains throughout the field, how will it look? So exactly it looks like that. Okay, they are non-spore forming organisms. They are non-motile. They are intracellular, so which means they require a host for their survival. They are aerobic in nature, most of them. Few of them could be facultatively anaerobic, but most of them are aerobic in nature. Now the organism can grow in the aerobic conditions, but their growth gets enhanced if you supply it with 10 to 20% of carbon dioxide. Which media can it grow? Definitely this organism can be grown on nutrient agar, the simple media, the basal media, but also the best media for it to grow is the liver infusion media, serum dextrose agar, tryptose agar. These are the different types of media where it will grow. It can also grow on broth. Okay, if the organism is grown on solid media, the colonies are small, they are moist, mucoid and glistening. They have a shining consistency. And if this organism is grown on liquid media, the colonies are powdery. The organism, it appears powdery. And if the organism is a little old culture, then the colonies become viscous in nature. Now moving on to the important species of this organism, there are different species, that is Brucella abortus, Brucella melitensis, Brucella suis and Brucella canis. Now here, how this organism spreads to humans, it is basically a zoonotic disease. Zoonotic meaning it spreads from animals to human beings. Okay, so talking about the species here, Brucella abortus, it spreads through cattle. From cattle, it comes to human beings. Melitensis, generally from sheep and goat, it spreads. Brucella suis, it spreads from pigs. And Brucella canis, it spreads from dogs. And if you see, the WHO has defined brucellosis as a zoonotic disease which is caused by the organism Brucella by drinking or eating unpasteurized dairy products, or who comes in contact with the body fluids of the infected animal. So that's what I told, it is a zoonotic disease which is definitely caused by this organism. And if you are coming in contact with the fluids, body fluids of the infected animal, or consuming the secretions, that is the milk or milk products, unpasteurized milk or milk products. Now let's move on to the types of infection. Generally in humans there are three types: latent infection, acute or subacute, and chronic. Now if you see latent infection, it is generally infection which is non-symptomatic, that is the person could be the carrier of the organism but the person does not show any symptoms. Okay. And it could be acute, that is it could stay for a very short period, few days to few weeks. Very rarely it could be chronic. Acute infection, acute meaning it is for a very short duration, and the organism is Brucella melitensis. It generally causes undulant fever. It causes bacteremia. Bacteremia is the presence of bacteria, this bacteria in the blood. And there is muscular pains that you see, and also there is asthmatic attacks. There is drenching sweats and chills. There is this intermittent of drenching sweats and chills. Drenching sweats means the person sweats very profusely, and followed by chills. Also there is constipation, but this is very acute, it's for a short period of time. Chronic brucellosis is also seen, that is there is no bacteremia seen, and here it could be any four species that I showed you in the previous slide, not a particular species. And the symptoms, it could be hypersensitivity, again sweating, there could be joint pain, there could be, it could lead to the infection of the bones. UTI also could get affected, and it lasts for years together. Okay. And the incubation of this disease is generally 5 to 60 days. That is, incubation period here means from the first time the organism has entered into your body and till the person shows the first clinical symptom. That's the incubation period. It spreads to humans by the body fluids of the infected animals, blood, placenta, urine, and feces. Now how it spreads, that is if the person is closely associated with the animals, or if it is a veterinarian, that is if the doctor who is treating the animals, his who animal is infected and the doctor has not taken certain precautionary measures, or if the person is treating, or if the person is helping during the birthing of the animal, all these situations the person can get infected, or even the milking, during the milking of the cow the person can get infected. Otherwise from the urine, the feces also, it can get, the person can get infected. Generally the foods associated, that's of course the milk and milk products. If the milk and the milk products are not pasteurized properly and the milk has been taken from the infected cow, definitely the person consuming those milk and milk products will be down with brucellosis. Also the meat, if anybody is consuming the meat which has been infected by the, I mean which has been contaminated by the cow, the animal has been infected by brucella, and that meat is consumed without proper precautions, without proper heating, boiling, etc., also the person can get infected. Airborne is very rare. That's generally during the birthing of the animal. It can be airborne. Human to human infection is not seen, it's very rare disease. Now how do you do the diagnosis? Generally diagnosis sample is collected from the blood, okay, because I told you it leads to bacteremia, okay, and it's grown on Castledia medium, and it organism grows, it doesn't take just 24 hours, but prolonged incubation is required for the colonies to be formed. Gram staining is done to check for the dense clumps of cocobacilli, the typical sand grain appearance, and also these organisms are urea positive, oxidase and catalase positive. How do you prevent the organism? That is Definitely avoid consumption of unpasteurized milk and milk products. Whenever you're consuming milk or milk products, make sure that they are pasteurized. Pasteurization definitely kills the organism. Avoid storing the raw meat for long time. I told you from meat also the organism can be spread. The person, while assisting the birth of animals, should definitely be protected by wearing gloves. Be aware of inhalation. Definitely during the birthing, it could spread. The organism could spread into the air. So definitely be careful during the in that area. Also, while adopting animals, make sure that the animal, it can spread through dogs also, if you have seen. Make sure that the dog or any pet is not infected by the organism brucellosis, by the disease brucellosis or the organism brucella. The veterinary staff especially should wear protective equipment while working with the animals. Make sure all these things are there. What are the antibiotics? Generally, antibiotics, 6 weeks of rifampicin is given, or gentamicin. Rifampicin or gentamicin along with deoxycycline is given twice a day for 6 weeks. That's almost for 1.5 months. Okay, definitely when you take antibiotics, there are side effects like nausea, vomiting, and also there could be loss of appetite. I wanted to also mention that this disease is also called as Mediterranean fever, and also it is also called as Malta fever, because these are the places where the infection was first seen, identified, and studied. So, Mediterranean fever, and it is also called as Malta fever. Thank you, students.